Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're heading to Ohio, speaking with Ohio State Representative Michele Grimm, someone who built her career on public health, equity, and community problem solving. Before joining the Ohio House, she served on the Toledo City Council, where she led a major medical debt relief initiative that wiped out debt for thousands of families. She holds a doctorate in law and policy, and she works every day to make healthcare in Ohio more affordable, more fair, and more accessible. She sits on committees that shape transportation, budgeting, and consumer protection. Her work focuses on prescription drug costs, medical billing, and the economic realities families face when illness strikes. She brings a public health mindset into a political world that often ignores it. Her journey shows what happens when expertise, compassion, and policy come together. Let's get into the conversation. First off, Representative Grimm, thank you so much for joining us today.
Thank you so much for having me, Stephen.
As I mentioned in the opening, you bring a unique blend of public health training and public office experience. What drew you from the community level work and research into running for elected office?
So I decided to run for office in 2021. We were still in the middle of a pandemic, not as robust as 2020, but 2021 we were still going through the pandemic and the uncertainty. And I had an opportunity to run for Toledo City Council. And I took that opportunity. I will kind of go back and say we left Ohio for 10 years, but then came back during the pandemic. So I had just come back, but I was familiar with the city because I was there for a decade before. So I decided to run for Toledo City Council and I won. And then another opportunity opened up to run for the State House because of redistricting. So everybody was kind of moving on from other parts of the state legislature. So I decided to run for that as well. So I was on Toledo City Council for a year and now I'm in my second term in the State House. But I think that someone with a public health background brings a unique perspective. When I was starting out, you didn't see a lot of folks with a public health background, but I think you're seeing more because people understand that public health, legislation, public policy really come together. There's a lot of decisions made around public health that's on the legislative level. You saw that during the pandemic, and you're still seeing that now, especially with like vaccine policy and that kind of thing. So I wanted to give back to my community as a public servant and bringing in my public health expertise in this role.
Excellent. Well, while you were in Toledo, you made national news for your debt relief work in the city council. What was it about that issue that moved you and what impact did the program have on families in your community?
Well, I heard about using ARPA dollars for medical debt relief through the Cook County plan. So Cook County was the first one who did the medical debt relief initiative. It was RAP medical debt at the time. Now it's undue medical debt. So they used a portion of their ARPA dollars to eliminate medical debt.
Just for our listeners, what are ARP dollars?
The American Rescue Plan dollars. So they were the American Rescue Plan dollars under President Biden that gave communities money to recover from the pandemic, basically. There were certain aspects that you could use these ARPA dollars. And so Cook County came up with this innovative initiative to use ARPA dollars for medical debt relief. And I saw that and said, we can do this in Toledo. And so I decided to spearhead the initiative in Toledo. I did get some pushback from my colleagues. I think they were uncertain about should we be using ARPA dollars for basic services? We went second. So it was still a very new concept. And luckily, our county commissioners also came in with a match. It was a $1.6 million match, $1.6 million, $800,000 ARPA dollars, and then with the county dollars, so it was $1.6 million to eliminate. We estimated about 41,000 Lucas County residents. It's now at 43. Plus, we were able to tap into undue medical debts philanthropic dollars to span across the entire region and around Northwest Ohio, which is about, 21 counties. It was 112,000 people received letters saying that their debt debt was canceled.
Wow, that's amazing.
Yeah. And then after our initiative passed city council, it kind of took off around the country, and a lot of other cities, even states, have done their own debt relief programs. And it's just been very successful. And I'm really glad to see how fast it took off and how successful it's been.
Yeah, no, amazing. Getting back to something you were touching on earlier, public health really became political during the pandemic. And we still feel that tension, of course. You mentioned vaccines. How do you approach conversations about vaccines, community health, and science with constituents who may distrust the system?
Yeah, so I think that when I do encounter people who distrust maybe vaccines or government oversight around public health, I like to stick with the facts. I will say a lot of older people remember the days of polio. They remember the days of smallpox. So I still get a lot of people who remember those days. And I think it might be like the middle generation to the younger generation who may not remember that stuff. So what I like to do is just say vaccines are safe. They're rigorously tested. They've prevented disease for millions and millions of people. Look at the outbreaks that we're getting with measles. I think there's another one in South Carolina, North Carolina, something like that recently.
Yeah, I had seen that, but yeah, I'm not surprised.
And so there's all of these disease outbreaks, but they're all preventable. They're all preventable with vaccination, with the MMR vaccine. I think that when people do doubt vaccines or any other public health policies, they're just thinking about like government overreach and that kind of thing. But like, again, it's protecting the public's health. When I do encounter someone who is vaccine hesitant, I would say it's more folks in more conservative areas or some of my colleagues on the other side of the aisle.
Yeah, that would actually leads me to my next question. I'm curious, behind closed doors, and obviously without divulging private conversations, have you been engaged with some of your colleagues in Ohio who have expressed, I'll just call it anti-public health, because that's sentiments, and how do you deal with that while in the legislature? Particularly what I'm referring to, private conversations. How do you deal with your colleagues who may be of that persuasion?
I would say that it can be difficult sometimes, right? Because like you can lay out the facts, but the facts don't necessarily matter. It's a very emotional topic for a lot of people. And again, is it about like government overreach? Is it about facts? And I think when you throw facts at people, it doesn't necessarily change their mind. And it's hard to change people's minds about these when they're kind of stuck. I just like to stick with the facts and the fact that like this has helped millions of people. This is why we don't have polio emerging right now. I mean, we may at some point, but like this is why measles is coming back. This is why we don't have smallpox. And I think that's what you have to kind of stick to, even though, you're not going to change their mind, but like that, the evidence that they're safe and effective.
Yeah, absolutely. No, but it's good to have those conversations with folks, not just on public health issues, but obviously on all issues. Even if they don't disagree with you, you got to have adult conversations, if you will.
Yeah, for sure.
Just switching gears, you've spoken about healthcare as a fairness issue. What does fairness look like to you when we talk about access, affordability, and outcomes?
I don't think that the current system is fair. A lot of people get left out. There's a lot of confusion with the current system. And with fairness, I think that the process needs to work for everybody and everybody needs to understand it. And a lot of people don't. There's always reports like the Kaiser Family Foundation does these like bill of the month. Like people don't understand their bills. People don't understand their coverage because it can be very complicated, especially with these high deductible plans. For a system to be fair, it should be accessible for everyone. It should be affordable for everyone. And people shouldn't have to fear going into bankruptcy or going into debt to pay their medical bills or to get health care. And a lot of people do in this country. We're the richest country in the world, and we pay the most for health care. And our system is completely unfair for people. To make it fair for people, I think is really important. I am a proponent of single payer. I know that we have a long way to go for that, but what can I do in my role besides advocating for single payer? What can I do in my role to try to make the system fair for people while we keep working toward a single payer system?
What advice might you have for someone who wants to advocate for themselves, a patient who feels overwhelmed by the system and powerless to change it? what advice would you give them as to where to start?
So I would say that I think the most comprehensive pieces of advice that I've seen for people is actually KFF Health. They've really laid out what patients should do if they get a bill. And I'm going to preface this by saying, we shouldn't have to do this. We shouldn't have to scrutinize every bill or negotiate every bill because we're not sure if we're getting billed correctly or we're not sure if we're getting charged correctly. But this is the system we have. I mean, your bills can be very confusing. Reading your bills, asking for an itemized bill is one of those things that they recommend. If you can't afford your bills under the Affordable Care Act, all hospital systems, all nonprofit hospital systems need to have a charity care system in place. So they all have charity care systems in place. Some of them are a little more generous than others. So somebody may think that they don't qualify for a charity care plan or a payment plan. They may, and they should ask. Now, the onus should be on the hospital, but it always is not. So ask, hey, what is your charity care plan? And I know people are scared of the word charity care, but it's just what is your charity care policy, that kind of thing. Again, we shouldn't have to ask for that, but we're in a system that we unfortunately have to. And so those are my pieces of advice. It's just look at your bills, ask for an itemized receipt, ask about payment plans or charity care programs, that kind of thing. And hopefully the hospital will work with you. They should work with you because they want to get paid. So yeah, but I mean, every hospital's different. So that would be my advice. I think there's places where you can go if you have questions about your bills, they can help you out. But I think those are the best pieces of advice that I've seen.
So let's end on a hopeful note. And with that, what keeps you hopeful in your work? Advocacy, what we do, can feel slow and frustrating, but what motivates you to keep moving forward?
People's stories. What motivates me is people reaching out with their stories. Those stories can be very frustrating. So I have a bill right now around medical debt, some medical debt reforms. It would ban wage garnishment and then cap interest rates at 3%. It's actually statutorily here in Ohio at 8%. We've had this hospital system in a rural area who's sued over 2,000 patients in the last 2 years. And it's a very tiny area. And so we've been hearing a lot from those people saying this bill that you propose will help me a lot. And that's what keeps me going, is that people are reaching out saying this would be helpful. Here's my story. We need relief. And so that's what keeps me going. Everybody's stories, people reaching out. And I think that even though that the system can get very overwhelming and depressing, there is definitely reasons to keep going. And we can bring change. And we've seen other states bring change around medical debt and other healthcare provisions. We could do it here in Ohio. We could do it across the country.
That is an excellent way to end, because we talk all the time on the show and when we meet with patients around the country that you are the most important advocate that we have, telling your stories to elected officials, telling your stories to policymakers. There is nothing more powerful than that, and it's great to hear that from an actual elected official. So thank you so much, Representative Grimm. Thank you for joining us. Thank you for sharing how public health experience can shape better policy. Your work shows that healthcare challenges are not abstract. They affect families, they affect budgets, entire communities, and we can tell from this conversation that you bring that to the State House every day.
Thank you.
Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.